Yes, I'm Bulavinaka, and welcome back to our series Oral Health
and Overall
Health. We welcome you today, and thank you for joining us here at Hope Channel. Of course, we welcome our guest, Dr. Pneumonia. I'm Florimbola, your host, and this is our guest, Dr. Bulavinaka.
Bulavinaka, everyone listening to this program today. What's the topic?
Yes, okay. We are looking at oral health, and today we are looking at the respiratory system, our respiration. And in our last discussion, we were looking at oral health and brain function.
Yes.
Yeah, and many of us, many people don't realize that infection and inflammation in the mouth directly affects the brain. And it can cause Alzheimer's disease,
Yes.
and a lot of other diseases that we now suffer from because we do not take good care of our teeth.
Yes.
And today, of course, we are looking at oral health and the respiratory system. Now, Doc, would you like to tell us briefly what goes on in the mouth that directly affects the airways and the lungs, and of course the oral bacteria that spreads beyond the gums do affect our respiratory system? Would you like to tell us briefly this dangerous issue that we have here?
Okay, oral health and respiratory system, it's interconnectedness of different parts of the body, but in one unit. They all have to work together. And today we'll see the surprising link between oral health and the respiratory systems. And that's about your lungs. Yeah, your lungs. And the air that you breathe goes into our lungs. Yes.
So this oral health generally or directly affects the lungs.
Yes.
So sometimes we think, smoking and all that. We usually say lung cancer and so forth. We need to consider how we breathe and the type of air that we breathe.
Yes.
Yeah, okay.
It's very important.
Yeah, this a pneumonia, type of pneumonia that's being mentioned here. Aspiration pneumonia.
Okay.
Yeah. Could you tell us a little about how this happens?
Our body has got microbes, Yeah, the microbiome. And there are some good bacteria, some good, some harmful. And how they grow, it's according to the lifestyle that we live. And for that, aspiration pneumonia happens when bacteria from the mouth are inhaled into the lungs, causing infection. You see, like the mouth has got its own set of bacteria. And it's amazing how our body function and what's going around in our body. And if we take control of this bacteria or the microbes in the mouth, by taking control means you do the right things, good things, a healthy lifestyle, and then they are normal. They just stay as they are. But if we flip and do things which is not good, unhealthy lifestyles, and then it will increase the number of these countless bacteria, and then also increase their functions.
In other words, Doc, we need to get up early in the morning and breathe fresh air. Go out because go out into nature, into the trees and plants. Because they let out carbon, which is oxygen. They take in carbon. We let out carbon.
Yes.
So we need to go out and breathe that fresh air, and do not expose ourselves in areas or situations where you will breathe in air that is dirty, like smoke, thick smoke. People who live in the rubbish dump, they're breathing all that, or close to
from the
even people who smoke and so forth. It's more dangerous to be beside someone that smokes, and when he lets out that air, you take it in. Then it directly goes to the lung and causes infection. Okay, really? So that is especially risky for elderly people. People with a weak immune system, and those in hospitals or in nursing care. They need to to be more careful with the
Yes.
type of air that they breathe. Okay, so
Important that we have
yeah.
healthy lifestyle, like taking in clean, fresh air, always good for the lungs, and it also contributes to a stronger immune system.
Okay. So this poor oral hygiene, what does it allow into the body?
Okay.
Yeah.
Poor oral hygiene, when the hygiene is poor, like toothbrushing, dental flossing, we can also say what we eat and drink, they all contribute to good oral care. And if it's poor, which goes into this poor oral hygiene, and then we just breeding harmful bacteria to increase in the activity, and we know that that if we do not have good oral care, then our breathing system is also impaired, and what goes into the lungs too, because it's not clean.
Yeah. So it when we breathe and eat, those bacteria can travel into our respiratory system.
Yes.
Okay, so it is also linked to chronic obstructive pulmonary disease, COPD. Okay, so studies show people with gum disease may be more prone to COPD flare-ups.
Obstructive pulmonary disease. We see our body; they are all linked. Yeah, and then if we see the makeup of our for instance, the skin. The gums is just a continuation of the skin. Yeah, the body skin, and but in different tissue. So that's why it's very important to make sure that all parts of the body is healthy. And the gums, then it continues into the linings, yeah, of the gut. And you see they all connected, but it's made in such a way that, but in different tissues, just say, yeah, but it's all continuous.
Okay.
Yeah.
Okay. Thank you for that, Doc. We'll move into mouth breathing and how the TMJ and sleep apnea is affected. Maybe let's just take a moment to look at sleep apnea. I have a diagram here.
Okay.
And what is sleep apnea?
Okay, sleep apnea is a sleep disorder. Yeah, a sleep disorder in which a person's breathing repeatedly pauses or stops and then starts again during sleep.
Okay.
Yeah.
So what are the main types of sleep apnea that we have? Research has shown.
Okay, go back into this sleep apnea. This pauses in breathing can last from a few seconds to a minute or more.
Yeah, breathing, you need air.
We need to breathe.
Stops like that. That's why when we are sleeping, we suddenly wake up in our sleep because the apnea is happening here.
Yes.
So what are those three types of apnea?
Okay, one is the obstructive sleep apnea.
OSA.
Yeah, and that's the most common type. Yeah, happens when the throat muscles relax excessively, blocking the airway. We were talking about this one, the oral health and the overall health. As we have been saying that different parts, but one body unit. They all have their own functions, and they all help each other. And another one is central sleep apnea. Less common occurs when it's less common and occurs when the brain fails to send proper signals to the muscles that control breathing. You see, we were talking about our brain and the oral health, and you see the messages has been going on every second. And the second type of sleep apnea is when occurs when the brain fails to send proper signals to the muscles that control breathing. And the third type, which is a complex sleep apnea, it's a combination of the 1 and 2.
Yeah, we're actually looking at the breathing habits. Some people breathe through the mouth instead of the nose.
Yes.
And the impact that it has. So how does this sleep apnea happen?
Okay. In obstructive sleep apnea, the airway becomes partially or completely blocked. And that's serious, eh? Yeah. When it's partially or completely blocked, when the muscles in the throat relax during sleep. You see, it's wonderful how we've been designed, eh?
Yes.
Yeah. When the muscles of the throat relax during sleep, then this can occur. Yeah. Partial or complete block of the muscles. And
These are factors, they increase the risk of obesity and all that. So,
yes. And we can also say that in a sleep apnea, the brain temporarily fails to signal the muscles to breathe.
Even it affects the brain.
Yeah.
It fails to
It
send the message.
temporarily fails to signal the muscles. You see, the muscles, the nerves, and everything, they await call from the brain, the nerves. Do this, do this, yeah, yeah. And when the brain temporarily fails to signal the muscles to breathe, and you were saying about these factors, okay, the factors that increase risk of sleep apnea include obesity.
So,
Yeah.
obesity is being huge.
Yeah.
So there's more you're prone.
Yeah, that increase.
If you are not, not trying to get your
into shape,
fitness, try and slim down.
Yeah, factors that increase include obesity, large tonsils, yeah, a small jaw, nasal obstruction, alcohol use, smoking, and certain medical conditions like high blood pressure or diabetes. You see, everything works together for the benefit, and if one of something creeps in, then it sort of lowers the maximum health benefits.
So diabetes, we all have them all there. If you are troubled with diabetes and all those other conditions, then remember,
it increases the situation,
and it will just add on to
the burdens.
already exist. Yeah. So what is important for us to know about sleep apnea?
Okay, it's very important because it affects the quality of life by causing daytime sleepiness.
So so feeling sleepy during the day, you're sitting and you're dozing off, there's a likelihood that you're suffering from this.
Yeah, at night, Yeah. Causing daytime sleepiness, irritability, and difficulty in concentrating. Yeah,
irritability, that any little thing makes you angry.
Yeah, irritability.
You get upset over little things. You're irritated over things, and you want to rush here and there, get irritated. So, that when you have sleep apnea, it will do that. Because, you're not having enough sleep. Wasting a lot of times in the night because your breathing is being blocked. Yeah. Okay, sir, continue. Yeah,
and also increases the risk of health problem, serious health problems. This you're not receiving the full rest benefit that you should be receiving during sleeping time because of the sleep apnea. Then it increases the risk of health problems such as heart disease, stroke, high blood pressure, diabetes, even sudden death. And I think now people are saying, hey, the ones are sleeping.
Die in their sleep.
Yeah.
It's happening.
No, it could be.
Blocked.
Yes. Yeah. So awareness, it's very important that now awareness allows for early detection and treatment which can save lives and prevent complications.
Yeah, so it is important.
Yeah.
So, Doc, please just help us. How can we monitor sleep apnea?
Okay. We can, these sleep studies, branch that studies sleep, conducted in laboratories to measure breathing patterns, oxygen levels, heart rate, and brain activity during sleep. I also come through an article which said that if you sleep between 9 to 12, around that time, there's a special hormone that flows within that time. And if you sleep after those hours, then you won't receive that.
So it's best to sleep early. If you want to do something, then wake up after 12, after midnight.
And wake up early in the morning at 3 a.m.
Because the body functions occur.
Yeah.
That's, I know that occur during the first 4 to 5 hours of sleep in the night, in the evenings.
And true. And also just correlate with for us to be having our dinner early, so that
Hospitals, they have it at around 4.
around 4. No, that everything is like in connection. Yeah. And also this home sleep test, simpler versions that measures breathing, oxygen levels, and airflow. Yeah, those are some of the things we can monitor our sleep, and then we can monitor our own sleeping patterns by trying to eat early dinner and sleep early, so that you can achieve all the benefits that should come.
Doc, what are the effects of sleep apnea?
Okay, effects, since you do not have a good night rest, because of these pauses and stoppages during sleeping, breathing, daytime fatigue, and sleepiness. Yeah, and fatigue and sleepiness increases the risk of accidents.
Cognitive problems.
Yeah, memory loss, difficulty in concentrating, and mood changes, irritability. Because you're not resting well at night, so irritability, depression, anxiety. You see, it's all
it's a mood change.
Yes, mood changes.
You're happy this time, the very next moment you're something else.
Yeah, because then
you're getting irritated very quickly.
Because if due to sleep apnea, because certain seconds of the night, your brain did not receive the oxygen.
The breathing.
Yeah, true. And that's why I think this mood changes and this thing can occur.
Heart problems, high blood pressure, and
arrhythmias and heart attack and stroke.
And how about those metabolic issues?
Yeah, the risk of diabetes and obesity. Because everything linked. No, there is always a study about the common health problems, the common health factor approach. All this illness or this disease, when we see, they all coming from the same factors.
So even complications in surgery and anesthesia.
Yeah, it's yes, because that's very important to understand the sleeping patterns of the patient, because as we have said that sleep apnea, it causes pauses or stoppages of oxygen into the brain, breathing. So that can really affect everything that comes along after that.
Just give us some advice and recommendations for sleep apnea, please.
So just some advice: you must always seek a medical evaluation. That's very important. If you snore loudly, and waking up. Some people, they wake up and gasping, And and then some said, okay, I'll wake up like the water coming from the nose, and they gasping or feel excessively tired during the day. Yeah, those are some of the things.
Lifestyle modifications that we have.
It's very important to maintain a healthy weight. As we have said, obesity is one factor that can come about with this sleep apnea.
Yeah, it's important to monitor your weight. It's the
very important.
And the other health folks are right now in Skuna Park.
Okay, that's good for our health
and staying on the scale.
Health assessments, and we got the Tanita scale, which is a very good.
So you maintain a healthy weight.
Yeah.
Avoid alcohol.
Avoid alcohol and sedatives before bedtimes. And sleep on your side instead of your back.
Sideways.
Sleep sideways.
Right side.
Yeah. Okay.
How about there are some devices here?
Devices that are being made to help us go through these sleep disturbances.
So we need to treat some underlying conditions.
Yes.
So those conditions would include, what would be included in those conditions?
Okay, we need to manage. Sometimes people go through sleep apnea because they have high blood pressure and diabetes or nasal obstructions. Yeah.
Some things blocked in the nose.
Yes.
Okay, so what do you monitor? Well, what should you monitor regularly?
Okay. No, there are some sleep specialists that will give us more advice of ways to have
To adjust.
adjust and have maximum rest benefit from sleeping.
Okay, so mouth breathing, dries out the mouth,
Yeah.
and reduces saliva. And without saliva protection, bacteria flourish, and raising the risk of both gum disease and airway irritation.
Yeah.
Now, how does the TMJ fit into this picture?
Okay. We're coming now from sleep apnea to mouth breathing. It's normal that we breathe through our nose, but some people, they breathe through their mouth. Sometimes when we have nasal obstruction or some underlying causes that we have to breathe through our mouth.
Yeah.
Okay, breathing through the mouth, it will cause dryness. Yeah, dryness.
It reduces saliva.
Yeah, reduces saliva. And okay, we're talking about the TMJ. If the jaw is misaligned or the airway is narrow, it can lead to obstructive sleep apnea.
We're just talking about it.
That's
when breathing stops.
That's when breathing stops temporarily during sleep, often due to the tongue or jaw blocking the airway.
Okay, so dental and jaw issues can actually disturb our breathing while we sleep.
Exactly. That's why some of the dental professionals now can help in diagnosing and treat sleep apnea.
Okay, Doc, let's have a look at some prevention and good breathing habits. Okay, so what can our viewers do to protect both oral and lung health?
Okay, what can we do to protect oral and lungs? Because they are just neighbors, Yeah. And what goes in between them is the air. So first of all, we have to have a healthy, fresh breath. And so the first line of protection is toothbrushing and floss daily to keep oral bacteria under control. It's a simple habit that we always harp about, but it's very important. Now we must be having a strong oral health care habit. I'm just not saying you have a good oral care. I'm saying now strong. I'm adding this word. We should be having now a strong oral health care habits. Let's by toothbrushing and flossing daily, and also our visitation. Our health-seeking behaviors. We just going to the dental office for when there's pain, but we should also instilling in our behavior of visiting the dental people for a wellness visit. Yeah, that's why I'm saying now we should have a strong oral health care regimen. Yeah.
Yeah, so our time is moving real fast. We just have a couple of minutes left there. So let's have a look at, also we should try nasal breathing whenever possible, rather than using our mouth for breathing.
Yeah.
And, God designed the nose with tiny hairs that filter air. It could be a sign of TMJ issues or airway obstruction. Okay, so that's what you've said.
Yeah.
For the mouth, the hair in our nose, that serves as filter. And the mouth does not have that defense. No. Please try and
think about it,
and use your nose for breathing rather than the mouth.
It's meant for breathing.
So have a look at Isaiah 42, verse 5. What does that verse say?
Okay, it says, He gives breath to the people on it and spirit to those who walk on it. Breath is a gift. We must protect it. That's very important, eh?
Yeah, so let's say someone always snoring or waking up tired. Could it be linked to their jaw or oral health?
Absolutely. Sleep apnea can be caused by dental or jaw misalignment. Treating it can improve sleep, energy, and even heart health.
Okay. So treating oral health issues, folks, could literally help someone
Yep,
breathe easier and sleep better.
true. Literally, eh? Yes, and it could prevent lung infections, especially in vulnerable groups like elders and children, eh?
Okay. Yeah, so we just have a minute left there. Let's have a look at some of our discussion questions there.
Yeah.
Have you or someone you know experience frequent lung infection and pneumonia? And, this could be, just looking at those options there, this could especially be real for older family members. Occasionally people never think of oral health
Yes, being a factor.
as one of the factors.
Yes.
And it is useful to remember that
Yeah.
oral health is important if you want, or because this is the entry point for all the bacteria. And when this is healthy, you can be certain that.
Yeah, because what happens in the mouth does not stay in the mouth, eh?
Okay. How about number 2? Do you or someone in your family snore heavily or wake up tired?
Yeah, do you?
Yeah, everyone at home snores.
Or something. Yeah, we have.
Snores. I do. I snore too. Yeah.
I remember one of my friends, he sleeps and snores heavily. Sometimes sleep apnea. And we could hear nothing, eh? Like it pauses, eh?
Yeah, it could be that we're stressed and the mouth is and the brain system, they are congested. Do you breathe mostly through your nose or your mouth? So the question is there.
Yeah.
Please, we encourage you, use your nose.
Your nose to breathe, eh?
God created our nose, use it.
It's very important.
What daily habits can reduce oral bacteria and protect lungs? Okay, you tell us.
Yeah.
What oral
Daily habits, which is a strong toothbrushing regime, eh? Yeah, brushing twice a day, cleaning the tongue, and trying seeing your dental professionals and staying hydrated. That's very important. Drinking water is very important.
water.
Yes.
Okay, just our last verse, please, Doc. Job 33:4 to close with.
The Spirit of God has made me, the breath of the Almighty gives me life. Let's honor that life-giving breath by caring for our lungs and mouths.
Please do take good care of your mouth and your lungs. Caring for oral health is more than hygiene. It is a way of honoring the breath God gave.
That's very important.
Thank you so much for
Thank you.
being with us in this session, and we trust that it has been helpful for you. And thank you also, Doc, for joining us and doing all that explanation. We will, in our next episode, we will be looking at the mouth and the gut-liver axis. So until then, we thank you and we'd like to say goodbye.
Manda.